Stay connected to the world around you. KPBS brings you trusted news, compelling stories, and in-depth reporting every day. Wherever life takes you, KPBS is here, on the radio, online, and on the go. Discover more at kpbs.org.
Welcome in, San Diego. It's Jade Hindman. On today's show, the latest as Kaiser healthcare workers continue their strike for better working conditions and fair labor practices. This is KPBS Midday Edition, connecting our communities through conversation. So thousands of Kaiser Permanente nurses and healthcare workers across California and Hawaii are on strike. They're alleging unfair labor practices amid prolonged contract talks. The union says more than 2,000 workers are on strike in San Diego. Heidi DeMarco has been covering this. She's KPBS health reporter, and Heidi joins me now. Heidi, welcome.
Thanks for having me.
Glad to have you on. So tell me, who makes up the union that's on strike this week? Which workers are we talking about?
It's mostly nurses, but also pharmacists, lab techs, therapists, and other frontline healthcare workers. So basically the people that you see when you go in for care.
Yeah. So what are the main reasons they're giving for striking?
Well, the say negotiations have stalled since last year, and they feel that Kaiser isn't bargaining in good faith. They filed a unfair labor practice charge, and they say it's about forcing the company back to the bargaining table.
So it's not just about wages. The union is really frustrated over staffing issues too, right?
Right. That's a big point. Kaiser says this is about pay, but the healthcare workers I've interviewed say the bigger issue is staffing, having enough people and resources to safely care for patients. They say they're burnt out and stretched thin.
Well, earlier this morning, we actually spoke with Union Representative Vanessa Caballero. She called us from the Kaiser San Marcos picket line. And here's what she told us about staffing.
There's moral injury when our members go into work every day wanting to provide quality care and do the care that they became a nurse for. And they feel like they can't provide that care because every day they have to wonder, do I even have enough people here to account for the number of patients that are in our units?
So high levels of burnout among healthcare workers is a growing issue across the country, especially since the pandemic. How are the union's concerns reflecting that broader problem here?
Yeah, it definitely does fit that bigger pattern, right? Healthcare workers across the country have been talking about burnout and staffing shortages and patient safety for years. So you're right. Since COVID, a lot of workers say the system never really recovered, and they're still being asked to do a lot more with less.
So bringing it back to this strike, I mean, how has Kaiser responded to the strike so far, and what have you heard?
Well, Kaiser says, they've put a generous offer on the table. Their latest offer includes more than a 21% wage increase over 4 years, and they called this strike unnecessary. They say hospitals and most clinics will stay open with temporary staff, but some appointments may be delayed or moved to virtual care.
So when was the last time union members went on strike, and what came of that?
It was actually in October of last year. It was a shorter walkout, and the negotiations continued afterward, but ultimately stalled again, which is why we're seeing another strike just a few months later.
Well, last week, Kaiser filed a lawsuit that could force unions to negotiate separately instead of as one national group. How are union members reacting to that? And if you could tell me a bit about how that works. Why would there be an advantage to negotiating together rather than separately?
Well, they're obviously not happy about that. The union says it's an attempt to weaken their bargaining power, right, by breaking them up into smaller groups. They say together, numbers matter here. So they want to be able to bargain as a national unit. So breaking them up into smaller groups, they feel will diminish their bargaining power at the table. And so they call it just a tactic to delay negotiations rather than resolve them.
So you mentioned a delay in appointments. Anything else you can tell us about how all of this is affecting patients and their access to care?
Well, right. I mean, Kaiser, when they do a strike, they do have to give a 10-day notice. So Kaiser does have a contingency plan. And so while they're bringing in, temporary staff or moving folks around, they say that emergency care will continue, but, patients will also see some longer wait times, some non-urgent appointments and maybe some elective procedures may be delayed. And like I said, some will move to virtual care. But the union says that's already happening because of chronic understaffing.
And Caballero, the union representative, says that the real cost to patient care is worker burnout, really. Here's what she said about that.
When they are not investing in patient care and with proper staffing, what happens is that every day this nurse comes in to work, they are doing everything that they can do to the best of their abilities to take care of patients. But the best of their abilities with limited staffing means that they can't actually do the most that they can do for every single patient.
You were out there on the picket line yesterday. What was the atmosphere like?
Well, it was definitely loud and energetic. There was music and chanting, lots of honking from drivers passing by. So, they were frustrated. How the workers were frustrated, but they really seemed unified. A lot of them kept saying that this isn't, about their paychecks, but it's really about the patient care.
How long are nurses and healthcare workers expected to maintain this strike?
Well, this is an open-ended strike, so there is no set end date, and union leaders say it'll continue until there's a contract agreement.
All right, I've been speaking with Heidi DeMarco. She's health reporter for KPBS. Heidi, thank you very much.
Thank you, Jade.
That's our show for today. I'm your host, Jade Hindman. Thanks for tuning in to Midday Edition. Be sure to have a great day on purpose, everyone.
From El Centro to everywhere, we're Voices del Valle.
Voices del Valle?
Voices del Valle is a team-produced podcast about coming of age in California's Imperial Valley.
I love Voices del Valle.
On the next episode of Voices del Valle, we will talk with teens about their cheer and soccer championship seasons. I've got to listen to that. Voices del Valle, fresh voices, bold stories made in the valley.
Voices del Valle. Find us on KPBS or wherever you get your podcasts.